Just got this really weird stare on her face. So I kind of look at her, I'm like, are you okay? And boom, she just starts seizing right in front of me. Rest of her exam was pretty normal. So, orders. Labs are just taking forever. I'm calling the lab, they're like, which is never a good sign. I didn't realize at that point, but it's not a good sign when the lab's taking forever. So I call them, they're like, oh, it's almost done. It's almost done. So finally the labs come back. And wah, wah, she's got a potassium of 114. Sodium, sorry, sodium 114. Potassium 114 would be really, really bad. That's another talk.
The Talmud, which is a collection of rabbinical writings, and it says that if the first son of a woman is circumcised and he dies, and the second son is circumcised and he dies, you should not circumcise the third son. It's pretty profound, right? I think everybody in this room could have figured that out. But there's more. So if you read on,
DEM is good because it reminds us that it's good to learn from your own mistakes. However, it's even better to learn from the mistakes of others.
Leopold died at a very relatively young age from an intracranial hemorrhage with no trauma. And he actually was one of the very first case reports in BMJ. Like, this is how old BMJ is.
Pelvic rest, follow up with your OB within the week. Let's refill your prenatal vitamins, okay?
Too far a follow-up.
5 days later, the most dreaded 5 words in emergency medicine.
Remember that patient you saw?
She returns 5 days later. Chief complaint is increased vaginal bleeding.